And still on the health situation in the country, health professionals in the country are making a passionate appeal to the President Uhuru Kenyatta to listen to their grievances and salvage the sector from total collapse in the wake of the COVID-19 pandemic. Through the Kenya Medical Practitioners and Dentist Union and the Kenya Union of Clinical Officers, the medical practitioners say they have been neglected even as they remain on the forefront fighting the novel coronavirus. And as Kamche Menza reports, thousands of health workers have been infected with coronavirus, with at least 30 losing the battle, including 10 specialist doctors. The two unions are now warning they will mobilize their members nationwide to down tools in the next few weeks if their plight is not addressed.
The rising numbers of COVID-19 fatalities and infections among the medical fraternity in the country has now led healthcare workers to call for urgent intervention from the head of state.
There is some disjointed management of this thing, and especially on the welfare of the healthcare workers, and we believe it's only by being able to sit with him directly that we can actually be able to do this.
We appeal to you to look into this matter because it is our lives. And our lives as doctors will not be sacrificed in this manner. Doctors will not engage in a suicide mission in the war against COVID-19 in Kenya.
Kenya Medical Practitioners and Dentist Union and Kenya Union of Clinical Officers have a raft of demands they want met, including provision of a comprehensive health cover, provision of quality personal protective gears, dedicated medical facilities for health workers, exemption of vulnerable groups from working in the dangerous environment occasioned by the COVID-19 pandemic, as well as entrenchment of the Health Service Commission in the final Building Bridges Initiative report. So far, the health sector has lost 30 healthcare workers to COVID-19 with over 2,000 infections, a scenario which they say could have been avoided had the government created a conducive environment for the frontline workers.
The government promised that it will ensure that it incur costs of medication for all the healthcare workers, but they have actually gone back and they recall that statement.
Just listen to this situation. You are in a facility, you don't have the right PPE. When you fall ill with COVID, you are told you don't have any cover. And even when you die, we actually have to even contribute to even get the bodies to go and bury.
For us to contribute money for treatment of doctors who have been admitted in various health facilities is very absurd and a very solid situation for this country.
The officials at the same time accuse the political class of interfering with the advancement of the health sector and therefore compromising the lives of millions of Kenyans who depend on public health service. Kenya Medical Practitioners and Dentist Union has issued a 21-day strike notice that expires on December 6, 2020, while Kenya Union of Clinical Officers say it will reach a decision on the next cause if their issues are not resolved within the next 7 days. With the COVID-19 fatalities and infections rising by the day, healthcare workers are now warning that a seamless service delivery at the hospital amid the pandemic may soon be interrupted as they hint of a nationwide industrial action. Kamche Menza for Channel 1 News, Nairobi.